Good afternoon, everyone, and welcome to another episode of CTLN Opinion Plus, where we have conversations about issues and concerns of the Latino community. Today, we are joined by Ellen Carter, Vice President of Program of Connecticut Health Foundation. Thank you so much for joining us, Ellen. How are
Thanks for
you?
having me, Marcella. Thank you. Pleasure to be here.
Thank you for taking your time. So, let's inform the people. Let us let them know a brief summary of what is the Connecticut of Health Foundation and its focus.
Sure. Connecticut Health Foundation is an independent, nonpartisan foundation. We envision a Connecticut where everyone, regardless of race, ethnicity, and socioeconomic status, can achieve optimal health. We were started, it's something called a conversion foundation. We were started in 1999. And the founders of the foundation decided that back then, that we should do our work in several ways. First, we provide grants to nonprofit organizations and government agencies. We advocate for policy changes that will improve health outcomes. We conduct potential solutions on research. We conduct research on potential solutions to health
Mm-hmm.
equity, and we publish reports and communicate to people about these issues and why they're important.
Okay. So I know that you came in a very rough time, about 3 or 4 months. And how has that been for you? What is your experience, and how has the pandemic affected the organization providing these services, or organizations in overall, and the communities that's being served?
Yes, well, the pandemic really brought to light a lot of the issues that our health foundation has been focused on for many years, and understanding that not everyone has the best opportunity to achieve optimal health, that there's large disparities, particularly communities of color, Black and Latinx communities, Latino communities have seen significant disparity throughout the pandemic. So the
Mhm.
foundation shifted pretty rapidly in over the course of 2020 to reallocate our dollars so that we could best support the communities that were most affected by the pandemic. Um, we were looking at how people of color were frontline workers. They were facing barriers to accessing testing, care, and when
Mhm.
vaccines came out, that was an equity issue to see who was receiving vaccinations.
Which I have that question, like how important is tell us how important is health equity, like, and how much is needed.
It's absolutely important. I mean, we know from the data that we have this perception of society where everyone can do as well as their neighbor as long as they work hard enough. But what we
Mhm.
understand is that there are barriers to health, and there are barriers to health based on your race, ethnicity, where you live. And that
Yeah.
is true in Connecticut. So if you look at the data, uh, at a very high level, it seems like everyone in Connecticut is pretty healthy and doing well. But then when you dive down deeper, you realize that some folks are not doing as well as others. And
Mhm.
so, what that means is that our approach for health equity and our approach for the pandemic meant that
Right.
we needed to invest in communities to ensure that their voices were being heard. So, if the state was coming up with a solution on how to bring vaccines to a predominantly Spanish speaking neighborhood, it was important that they heard from Spanish speaking individuals about how best to do that in order to allow for vaccinations to happen and occur. So all of our approaches are informed by this idea of what health equity looks like,
Very important. Yes.
and how can you change your approach that so that you're actually affecting the people that you hope to.
Now that you mentioned the Latinx, Hispanic, Latinos, how does the foundation work with with the non-English speaker communities, and how do you make them aware of this foundation with your great services, programs, and research and grants? How do more or less do you guys go about that?
Sure, that's a great question. Well, it's a tricky thing too, because philanthropy, we don't provide services on the ground. So we're not the
Okay.
healthcare providers. We're not the people who we're directly relating to individuals every day. But some of the ways that we try to get the word out about health equity issues are through our trusted partners. So through the grantees and through other individuals that we fund. So during the pandemic, we began to work with organizations that we call trusted messengers. These are people and organizations that are of and from and speak the language of their community. And we gave out grants to these folks to be able to increase their outreach to communities in order for communities to stay healthy and get assistance when they needed. We also do some work around helping to build the awareness on a system level, so at the state and local level, about the importance of just understanding what the communities are that we serve. There was a census during the pandemic, we had a census in our communities. Data was collected. That's a tricky thing in a number of communities about the trust of data. And so one thing that we've been doing is having some research, but also technical assistance about how to properly collect race, ethnicity, and language data, so that when someone shows up at a doctor's office, we can be looking at information about, are their outcomes different because they speak a different language? And so some of the work we have done is around that. And then finally, one of the big things that we do is fund media reporters. So reporters that focus on health equity and health policy and specifically. And we ensure that those media grants are producing content in Spanish so that the stories can be distributed throughout the Latino and Latinx media community, because we realize that that's an important source for information for folks.
Nice to know. So, Connecticut Latino News, we have that insight, that great insight for them. Now, I went to the website and I was seeing, I was checking out the website and I see that you have this amazing tagline. And I know you kind of touch on it a little bit. And your tagline reads, changing systems, improving lives. What is the theory behind the systems change and how do you guys make it happen? And how does the organization foundation make it happen?
Yeah, systems change is tricky. It sounds really complicated and wonky. And really what it means is that we're trying to identify the rules and the policies and the practices that are in place at a higher level than when you're delivering a program that affects the way that the outcomes that people have. So how are things being done, and what's the policies, laws in place behind the way things are done that affects people's lives? So some foundations focus on just supporting the program, making sure soup kitchens are open, making sure that education programs are running for youth. But what we're trying to do is go a level further and figure out how the system that program operates within needs to change in order to change outcomes. Because really, when you talk to people at systems change, you say that the system is working how it's set up to work. So if there's inequity in the outcomes, it means that there's something wrong in the way the system was set up in order to get that inequity. And that's what we're trying to affect. And so one way we look at this is who's doing the work within a system. And we've done a lot of work about community health workers recently. Community health workers are these go-between, in-between people. So they have some skills. They're usually from a community. So if you are in New Haven or Hartford, you're a community health worker in New Haven or Hartford, speaking the language of the population you're serving, and you're providing a gap in care between what someone may understand a doctor is saying or provider is saying and what your actual needs are. Can you get food? Do you have appropriate housing? So one of the things that we looked at is not just how to increase the number of community health workers that are available in healthcare systems, but how can they be paid for so that you don't have one community health worker one place, but not in another place because there's no funding for it? And what is the standard of care for community health workers? Is there a certification program for them at the state level? So that's one way to take a solution and look at it not only at the piece that it affects on the ground, but also how can you scale that so it affects the whole system?
Right, the whole package.
Yeah.
So, in your experience, what group has been hit as hardest, with health equity?
In Connecticut, the two groups that are hit the hardest are Black and Latino communities. And that there's a variety of reasons for that. But we see really disparate outcomes, especially in the Black and Latino, around maternal health, around asthma and chronic disease.
Yeah.
And so just the rates of those things within the communities are much higher than they are for white counterparts. And I think it's important for us to look at the research behind why those
Yeah.
disparities exist, but also create very culturally responsive approaches to why how we can change those outcomes for people in the future.
And you guys offer, what are the towns that do you guys cover the entire state or any particular towns?
So we cover the state of Connecticut and
Mhm.
provide grants throughout the state of Connecticut. We also provide resources for nonprofits and activists throughout the state of
Mm.
Connecticut on our website, cthealth.org. There's some great infographics on there about
Mhm.
structural racism and how it affects outcomes for communities of color. We also have some great information on how to get access to healthcare. It's a tricky
Yes.
thing. It's a tricky thing, especially in the Latinx community where you may have a mixed family of documented and undocumented individuals. How do you get care for children in that situation? So we have some great resources around that.
Yeah, that could be a little messy for some community, like for some families, which they also have the language, barrier, and they're like, where do I go? What do I do? But I want to finish this interview, and I want to see if there's any other information that or resources that you would like to share or add with our audience. Anything you guys are working on, anything that's coming up, for the state of Connecticut for the foundation. Is there anything you want to say?
Sure. I
Ellen?
mean, we're in the process of finalizing a strategic plan. I think that we're looking at how do we do this work even, with even more impact
Mhm.
than we have over the last almost 20, more than 20 years.
Yeah.
And I would just, again, keep going back to that website. We continue to have connection to some of our advocacy partners. We fund folks who look during the legislative session in
Right.
Connecticut and keep an eye on bills that are being passed, advocate for
Mhm.
bills that are being passed, and we try to just make connections and provide resources for folks who are on the ground trying to make change and improve health equity.
Well, seems like you're doing a great job for your 4 months.
Thank you. Yes, a lot to be
You're
done.
doing Thank you so much for putting all your efforts and work into this issue, health equity and race in the state of Connecticut. Thank you so much.
Oh, thank you.
All right, that is all the time we have. Thank you, Ellen, for joining us this afternoon. Join us for another episode in 2 weeks. For more information about our discussion today, check out our web story on ctlatinonews.com. Follow us on Twitter at CT Latina News and Instagram at CT_Latina News. I'm Maricela Baez with CTLN Opinion Plus. See you next time.